Cardiovascular pathology, Wolff-Parkinson-White. All right, so for Wolff-Parkinson-White, this is relatively high yield, and it's a question that they love to ask you about. So the first thing I want to cover is the EKG. So for the EKG, what you have to notice is the delta wave, okay? And so take a look at it, look up the delta wave, look up at Wolff-Parkinson-White EKG, and you'll be able to see it. This is probably the first thing I look for in every single EKG, just so I never miss it, because I hate missing a Wolff-Parkinson-White question because it's so easy. So I always look at the PR interval. If I look at the PR interval and it's shortened, okay, then I know that I'm dealing with something associated with Parkinson-White. And then if I see that delta wave that comes out a little bit, then I know for a fact it's Wolff-Parkinson-White, because nothing else, no other pathology has that delta wave with the shortened PR interval, okay? Now the question is, why do we see that in the EKG? Very simple, okay? So what happens is that we have an accessory pathway, okay? An accessory pathway. And the accessory pathway, it's known as bundle of Kent, okay? And what happens is it's a fast shortcut between the SA node and the AV node, okay? From the atria to the ventricle. And what it does is that it's gonna bypass our AV node, okay? So it's from our atria to our ventricle, and it's gonna bypass the AV node. Now, why is that important? The reason it's important is because what do we say about the AV node? The AV node is gonna make sure that it slows down conductivity in order for the ventricles to fill. Well, guess what? If we don't have that slowed down AV node, okay, that checkpoint with the AV node so the ventricles can fill, and we just have a quick, fast accessory pathway that goes right from the atria to the ventricles, my ventricles are gonna contract with barely any blood in them, okay? And when they contract with barely any blood in them, the patient is most likely to have syncopal episodes, okay? So if you see like a young kid and he's having like some syncopal episodes, okay, or maybe tachycardia with palpitations, okay? And they're gonna show you the EKG with the delta wave and the PR interval that's shortened. Definitely start thinking about Wolff-Parkinson-White. And they love to ask about the pathophysiology behind it. Remember that it's an abnormally fast accessory conduction pathway. So we have a random extra accessory conduction pathway from the atria to the ventricles that skip over that rate slowing AV node, okay? Now, the differences between paroxysmal supraventricular tachycardia and Wolff-Parkinson-White syndrome is probably something that you might be asking now, because they have very similar presentations, young patients that have syncopal events. Okay, first thing, 100% look at your EKG. If there's a delta wave and a shortened PR interval, boom. Okay, definitely start thinking about Wolff-Parkinson-White. If there's buried P waves with narrow QRS, then start thinking about our paroxysmal supraventricular tachycardia, okay? Not only that, syncopal events are going to be more likely to occur with Wolff-Parkinson-White. Okay, that's another thing that you can look at. And lastly is the pathophysiology. We have an abnormal fast accessory conduction pathway from the atria to the ventricle that skips over the AV node with Wolff-Parkinson-White. Okay, with paroxysmal supraventricular tachycardia, you're not skipping over the AV node. You just have a re-entrant track from the atrium to the ventricle, and it's most commonly in the AV node. Okay, so you have retrograde kind of flow. Does that make sense? And so that's why you kind of have tachycardia for paroxysmal supraventricular tachycardia. With Wolff-Parkinson-White, you're just beating the ventricle way quicker than what it should, and you're completely bypassing the AV node. If you have any questions on this, let me know. Paroxysmal supraventricular tachycardia is lower yield than Wolff-Parkinson-White. So if you're at 50-50 and they're not showing you the EKG and you're rattled, I'd say put Wolff-Parkinson-White. But just know that difference, okay? So once again, Wolff-Parkinson-White, it's going to be a young patient. They're going to have some syncopal event or some tachycardia or palpitations, right? And they're going to talk about some type of accessory conduction pathway by skipping the AV node, and they're going to show you that delta wave and shortened PR interval. Patient's treatment for Wolff-Parkinson-White is going to be procainamide, okay? And we're going to talk about procainamide specifically later on, but just know that procainamide can treat Wolff-Parkinson-White.